When we understand more about whether these vaccines simply modify disease or whether they also reduce transmission, then I think we can give you a more sensible estimate of that.
The NHS has been asked to be ready to deploy a coronavirus vaccine from the start of December, Health Secretary Matt Hancock has stated. It was announced on Monday that the COVID-19 vaccine is currently being developed and has been found to be 90% effective in preventing people from getting the virus. But what are the concerns about this new vaccine?
I think it's encouraging. I think we just have to be a little bit cautious about getting too excited because there's still some steps to be taken here. Scaling it up to get it into production, finding out whether it will actually work on large populations, on whole populations, and then, the acceptability of the vaccine, because there's been a lot of negative publicity about the vaccine. So we need to know that the vaccine is safe so that we can really get behind it and encourage everybody to have it. And then there's still the problem that the virus might change, it might mutate, so that the vaccine, whichever vaccine is used in the end, needs to be effective, and it may not be effective if the virus changes. And these viruses are very simple life forms. They're similar in their own way to influenza, which constantly changes. And each winter we have to have a different vaccine depending on which of the strains of the flu virus that are going around at the time, and it may well turn out to be the same sort of thing with this. So in summary, it's encouraging. I mean, we all want to have this vaccine coming along, but we just have to be a little bit cautious about getting too carried away at this point.